Hi, my name is Garrison Thornton and I'm an undergraduate at North Carolina State University studying genetics. Today I'll propose a better treatment for hypothyroidism that is feasible and durable. Hypothyroidism is one of the most common autoimmune diseases in the country and treatment has remained the same. There are two main types of hypothyroidism, congenital hypothyroidism and Hashimoto's disease. I'd first like to start off with a video explaining how the thyroid gland works in your body.
Your thyroid gland is found just below your voice box, or larynx. It wraps around your windpipe, or your trachea. Your thyroid affects your metabolism. It makes hormones that affect how fast your whole body works and how it uses energy. Your body uses thyroid hormone to increase your energy and raise your body temperature when needed. For example, that helps replace the heat your body loses when exposed to cold weather.
As you heard from the video, your thyroid acts to control metabolism and energy. Now, what is hypothyroidism? Hypothyroidism is shown to impact 10% of the United States population, where 5% of the population is diagnosed and the other 5% is undiagnosed. Of the patients who are diagnosed with hypothyroidism, one-third of patients still experience some symptoms. This shows that the common treatment for hypothyroidism needs to be further researched and developed. Hypothyroidism also impacts more white individuals than other races and affects more women than men. This graph shows thyroid-stimulating hormone levels compared to women and men between different age groups. Elevated thyroid-stimulating hormone levels is an indicator of hypothyroidism. As you can see from the graph, more women are affected by hypothyroidism than men, and hypothyroidism cases is seen to increase with age. Hypothyroidism is characterized by an insufficient amount of thyroid hormones in the body. There are two types of thyroid hormone, thyroxine, known as T4 hormone, and triiodothyronine, commonly referred to as T3 hormone. T4 hormone is converted into T3 hormone by the removal of an iodine molecule by deiodinases. T3 hormone is the active form of T4 hormone and regulates metabolism. Both T4 and T3 hormones are produced in the thyroid gland. When thyroid hormone levels are low, the hypothalamus releases thyrotropin-releasing hormone, or TRH. An indirect regulatory circuit was found between the arcuate nucleus and the TRH neurons of the paraventricular nucleus in the hypothalamus. This circuit was found to regulate the set point of thyroid hormones by suppressing the mechanisms that produce T4 and T3 hormones after a period of no food consumption. When the circuit is inhibited by leptin, normal production of TRH occurs. TRH stimulates the pituitary gland to release thyroid-stimulating hormones. The thyroid-stimulating hormones bind to receptors on the thyroid gland, which causes the thyroid gland to release T3 and T4 hormone. Most cells contain deiodinases in order to convert T4 hormone into T3 hormone because the majority of the hormones produced in the thyroid gland are T4 hormone. The thyroid hormones act to regulate metabolism by stimulating cells to increase uptake of glucose for aerobic respiration. Thyroid hormones also stimulate an increase in respiration rate and heart rate in order to supply the additional oxygen and nutrients needed for ATP synthesis, which in turn supplies the energy needed for higher metabolic rates. Since patients with hypothyroidism experience an insufficient amount of thyroid hormones to stimulate the regulation of metabolism, it is important to treat them with supplementary thyroid hormones in order to bring their hormone levels up to a sufficient amount. The most common treatment for hypothyroidism is levothyroxine. Levothyroxine is a synthetic supplement for T4 hormone, and as previously mentioned, most cells contain deiodinases that can convert T4 hormone into T3 hormone. The proper way to take levothyroxine is to consume a pill every morning an hour before eating in order for the synthetic T4 hormone to be properly absorbed by the body. Take a look at how levothyroxine changed the life of Paige, a student here at NC State.
How did your life change after you started seeking treatment?
Well, I didn't really notice physical changes in my body at first because I think it was at least 5 months. But I could definitely people were starting to when I would go places with my parents, they'd be like, "Oh, you don't have a double chin anymore. Are you working out?" And people would say, oh, like, I can really, your facial features are popping, and it's like people were, like, being, like, more friendly, and, like, they were, like, I guess I was more approachable.
Levothyroxine properly treats the majority of patients with hypothyroidism. However, 1/3 of patients taking levothyroxine still experience some symptoms of hypothyroidism. Take a look at some symptoms Paige still experiences.
Do you still have any symptoms?
Yeah, I do notice, well, I think the biggest symptom that I think I'll always have is, like, cold hands and feet, and, like, I'm always cold. Even, like, in the summer, sometimes, like, I'll get goosebumps, so that's kind of annoying. But especially, like, in the winter, like, I just feel like it's almost unbearable. But I think another thing is, like, my hair is really thin, and I think that's another side effect is having, like, brittle hair and, like, nails. Like, my nails are really fragile.
Right.
As you heard, Paige still experiences side effects even when taking levothyroxine. There are some ways clinicians can adapt levothyroxine to limit symptoms patients still experience, and I will talk about those next. Levothyroxine can come in many forms to be more adaptive to patients who have various diseases such as gastrointestinal diseases. Someone who has a GI disease should take a soft gel levothyroxine pill because the soft gel pill was found to absorb better in patients with GI diseases. There are also other methods for treating hypothyroidism, such as a levothyroxine and levotriiodothyronine combination treatment. Some patients experience issues with deiodinases not being able to convert T4 to T3. Therefore, the patient would need a direct supplement for T3 hormone, which is the role of levotriiodothyronine. There are no additional side effects for taking both combinations of synthetic thyroid hormones. The main issue that clinicians face when developing a treatment plan for patients with hypothyroidism is the ability for the individual's body to absorb the synthetic thyroid hormone supplement. For the majority of patients, their bodies are able to properly absorb the synthetic thyroid. However, there may be issues with the patient compliance while taking the synthetic thyroid hormone. If patients do not strictly follow the guidelines of taking synthetic thyroid hormones in the morning an hour before eating, there will be significant fluctuations in their thyroid hormone levels. Any significant fluctuation can cause negative side effects such as headaches and fatigue. Take a look at what happens to Paige when she takes her pill at a different time than normal.
Do you take it the majority of the time at the same time?
Yeah.
Every day?
I think, like, during classes, it's helpful, like, having, like, a Monday through Friday schedule, so I wake up at the same time, and, I take it at the same time, but the weekends, I definitely don't take it at the same time. I probably take it, like, 4 to 5 hours later than I would.
So, do you experience any side effects after that when you don't take it at the right time?
Yeah, I mean, I think the weekends I still feel, like, I feel energized, obviously, because it's the weekend, but I don't really notice, like, an excessive tiredness until Monday or Tuesday. Like, I guess when everything starts to settle in and, like, my metabolism is slowed down. Like, if I eat a lot on the weekend, I definitely feel it the next few days.
As you can see, Paige experiences extreme tiredness if she takes her levothyroxine pill a few hours after she would normally take it. Some other factors that clinicians have to consider when treating patients with hypothyroidism is the patient's diet and prescribed medications. Calcium, commonly consumed in breakfast meals, has shown to interfere with the absorption of synthetic thyroid hormones by the GI tract. Commonly prescribed medications such as proton pump inhibitors have also been shown to impact the absorption of synthetic thyroid hormones by the GI tract. Another issue clinicians face that was touched on earlier is treating patients with hypothyroidism who have gastrointestinal diseases. Patients with gastrointestinal diseases experience fluctuations in their gut pH levels that can interfere with the absorption of synthetic thyroid hormones by their GI tract and cause negative side effects. There needs to be a way to treat patients with hypothyroidism by bypassing the GI tract and not relying on patients to follow the strict guidelines. I propose a solution that would directly release T4 thyroid hormone into the bloodstream and bypass the GI tract. I propose a T4 thyroid hormone rod. An example of this technology that is currently used today is the Hormone Rod, which is a form of contraceptive that is inserted into the subcutaneous level of the skin in the patient's arm and slowly releases hormone into the bloodstream for as long as 5 years. The Hormone Rod insertion is non-invasive and results in minimal pain to the patient. After the Hormone Rod is inserted, the patient does not have to take any pills every day or have to get a prescription refilled. A T4 hormone rod would benefit any patient whose body fails to absorb the proper levels of levothyroxine. A clinician would have to determine the controlled rate of T4 hormone released into the bloodstream that is unique to each patient. They have to consider factors such as age and weight. However, weight is found to be the most important. The goal of the T4 hormone rod is to remove the side effects still experienced by some patients who currently take levothyroxine. T4 being released directly into the bloodstream would require no further action by the patient except for the initial implant and follow-ups. This would bypass one issue that patients face, which is the ability of pharmacies to switch levothyroxine brands without alerting the physician. Various brands can contain slight differences in dosages, and it was found that any slight difference in the patient's dosage of levothyroxine can alter their thyroid-stimulating hormones and produce adverse effects such as headaches, fatigue, and decreased metabolism. After the hormone rod is produced, it would be implanted in the patient, which allows the patient the freedom to eat, drink, and wake up in the morning without having to worry about taking the levothyroxine pill or worry about anything interfering with the absorption of T4 hormone. An issue that the hormone rod would face is controlling the amount of levothyroxine released into the bloodstream. Each patient requires a treatment plan that is tailored to their specific body, which includes dosage. The hormone rod would have to have the ability to be adaptable to each patient. A clinician would design the treatment plan for the patient, then the T4 hormone rod would be built for their specific needs. Overall, the T4 hormone rod could improve the quality of life for a patient and decrease hypothyroidism side effects that some patients who take levothyroxine still experience. To summarize my main points, I have included a list of what is important. Hypothyroidism is one of the most common autoimmune diseases. The disease is caused by an insufficient amount of T4 and T3 hormone in the body. Thyroid hormones are important regulators of metabolism by stimulating cells to uptake glucose to produce ATP. Thyroid hormones also increase heart rate and respiration to supply more oxygen to cells for aerobic respiration. When there is a deficiency in thyroid hormones, the body cannot regulate production of ATP properly, resulting in fatigue, weight gain, and decreased energy levels. Levothyroxine is the most common treatment for hypothyroidism. However, some patients still experience symptoms of hypothyroidism while taking levothyroxine. The main cause of these symptoms is improper absorption of levothyroxine by the GI tract, which is either caused by GI diseases or the patient's noncompliance of taking the levothyroxine pill in the morning an hour before eating. A T4 hormone rod would bypass the GI tract and release T4 thyroid hormone directly into the bloodstream, which would decrease undesired symptoms in the patient. The patient's quality of life would ultimately benefit the most from the T4 hormone rod. I would like to thank Paige Knight for allowing me to interview her. The information she shared about her hypothyroidism was valuable for this presentation. I would also like to thank Dr. Estes for her continued guidance and feedback on this project.